The title of this video is not insinuating that your doctor knows something he's not telling you, but that he may lack the knowledge concerning fibromyalgia and he can't share it with you. Stay with me. We have a lot to talk about. Oftentimes, general practitioners are extremely busy and have a very wide knowledge base, but not necessarily a deep understanding of specific conditions like fibromyalgia. Many women over the years have been made to feel like they're crazy or lazy by their general practitioners because their symptoms can be so extreme and widespread. Many women with fibromyalgia have grown helpless because the modern medical treatment has been so poor and ineffective. Modern medicine tends to cover the symptom instead of looking for the root cause. Let me give you a quick example. You have a severe migraine headache. They give you Amitrex, which may reduce the headache, but not the underlying cause, which could be high blood pressure, eye strain, or a brain tumor. As a functional medicine practitioner, we take time to look deeper into our patient's physiology to find out what the hidden triggers and aggravating factors might be. In this video, I'm going to share with you what I've discovered in the last 15 years working face-to-face with a variety of fibromyalgia sufferers. If you truly want to recover from fibromyalgia and get your life back, this information will be extremely valuable. Before we dig into the material, let me quickly tell you a little bit about myself.
Dr. Mark Dailey is president and CEO of Birmingham Functional Medicine, founder of Fibromyalgia University, a certified functional medicine practitioner, and a nutritional counselor with advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and thyroid function. With over 25 years in clinical practice, he focuses on chronic conditions like fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, as well as autoimmune conditions.
I believe you'll get your greatest insight into fibromyalgia by simply understanding the proper definition of the word syndrome. According to Webster's dictionary, a syndrome is a bunch of symptoms that occur together. Many different diseases can cause the same syndrome. Let me say that again. Many different diseases can cause the same syndrome. Remember, you've been diagnosed with fibromyalgia syndrome. But let me give you an example. Fever and a sore throat is a very common syndrome. It can be caused by diseases as different as bacterial pharyngitis, the flu, or cancer of the larynx. As you can see here, we have three completely different diseases that cause the same syndrome. In order to resolve this syndrome, you would have to first of all determine the actual underlying cause of the symptoms, and then address each of these three causes differently. You don't treat the flu the same way you would treat bacterial pharyngitis. And of course, you don't treat cancer of the larynx the same way you would treat the flu. Three completely separate diseases or conditions causing the same or very similar symptoms. If you're going to understand fibromyalgia syndrome, this concept is vital. Now, in the same respect, people suffering from fibromyalgia syndrome share many common signs and symptoms, yet have a variety of different predisposing factors as well as many different previously diagnosed or undiagnosed conditions, as well as different lifestyle choices that have led you to be diagnosed with the same syndrome. The individual suffering from fibromyalgia is not going to get healed with the masses. It's going to be done on an individual basis. That's why there will never be a single pill that will cure fibromyalgia. This is actually good for you. You don't have to wait for some genius in a distant land to discover a single cure for fibromyalgia for you to regain your health. From a functional medicine perspective, we don't treat the disease. We treat the person. In order for you to get better, we have to expose and pick apart each aggravating condition, underlying predisposition, and aggravating factor. We peel these back like the layers of an onion. I'm going to address that concept as we continue, so hang on. In functional medicine, we do a complete medical history, lifestyle, and travel evaluation. We use metabolic assessment forms to give us insight into each individual patient. We use this information to determine what advanced testing might be necessary. The advanced testing might consist of stool samples, urinalysis, food sensitivity testing, mold testing, autoimmune testing, saliva testing, environmental and heavy metal toxicity. Once we gather that information, we then, and only then, design a treatment protocol for each individual patient. That's what we call the discovery phase of our treatment protocol. The discovery phase is followed by the treatment phase. Of course, we treat only what we find. Now, let me quickly recap. Fibromyalgia is a syndrome. A syndrome can be caused by many different underlying conditions, predisposing and aggravating factors. Although fibromyalgia patients have many common symptoms, or many symptoms in common, the actual cause can vary with each individual. In order to get well, recover your life, and reach your destiny, you have to peel back the layers of dysfunction. After working with fibromyalgia patients for over 15 years, I can tell you quite simply that fibromyalgia is caused by multiple layers of dysfunction. No two fibromyalgia patients are exactly the same. Fibromyalgia is a multi-system breakdown. So if you think about the body in terms of systems, there are multiple systems that have broken down. That's why there will never be a single pill to cure fibromyalgia. Fibromyalgia is not like heart disease where you may have a clogged artery. In that case, the condition is revolved around one organ, the heart. That's what I call the big lie. People think that fibromyalgia is caused by one issue. Maybe it's a faulty gene, a genetic disorder, or any one distinct and separate problem. The cause and the cure of fibromyalgia can be veiled in that mystery. Now, if the drug companies keep the cause of fibromyalgia veiled in ignorance, they can sell you their medications until the day you die. But nothing can be further from the truth. Fibromyalgia is the result of your body being overloaded by several underlying issues that finally led to a breakdown or a complete strain to function. Have you ever heard the story of the straw that broke the camel's back? Well, a camel is a strong animal, a beast of burden, if you will, which can carry heavy loads. A man started loading his camel down with heavy bags, clothing, silver, and even gold for a long journey. Finally, he put straw on the camel's back, which the camel would eat along the way. When he put the last piece of straw on the camel's back, the camel collapsed. The question is, was it the final straw that broke the camel's back, or was it the heavy burden he was already carrying? Now, let me relate this to the fibromyalgia patient. And this is just one possible scenario, so please don't get hung up on this. If you're an American or live in the West, your diet is less than desirable in most cases. It's filled with additives and preservatives, growth hormones and antibiotics, unhealthy fats, as well as tons of salt and sugar. It simply doesn't contain the nourishment your body needs to enjoy good health. So your body is struggling under that heavy load. Consider that layers 1, 2, and 3. Over time, this causes dysfunction of the gastrointestinal system. This changes the environment of your gut. And the gut, or gastrointestinal system, is like the hub of a wheel which has spokes to every area of your body. Hippocrates was known as the father of modern medicine. He said all disease starts in the gut. 90% of serotonin is made in a healthy gut. Serotonin is the happy neurotransmitter, also the controlling neurotransmitter that signals all other neurotransmitters. 70% of your immune system or more is located in your gastrointestinal system. Many of your B vitamins are manufactured in a healthy gut. Your inactive thyroid hormones are converted to their active form in a healthy gut and liver. Your gut lining can become permeable, also known as leaky gut syndrome over time. This means larger than normal molecules as well as waste products slip from your gut into your blood. This causes your immune system to attack these larger than normal molecules, which in turn cause systemic inflammation or system-wide inflammation. You could say body-wide inflammation. The inflammation causes stiff and sore muscles and joints, aches and pains, brain fog, and fatigue. Now, does that sound familiar? It can even lead to autoimmune diseases like lupus, Hashimoto's, rheumatoid arthritis, even MS, to name a few. As the environment of your gastrointestinal system changes, you literally open the door to things like parasites, yeast overgrowth, viral infections, autoimmune diseases, and pathogenic and opportunistic bacteria. Now, not everyone succumbs to the exact same issues, but everyone that's been diagnosed with fibromyalgia has multiple layers of dysfunction. I'm going to show you this with a real patient in just a moment, so hang with me. So as you can see, what starts out as a poor diet can lead to layers of dysfunction. I didn't mention the assault your body is under every day through a toxic environment with chemicals everywhere you look. Your body has to deal with chemicals you clean with, chemicals you breathe. I've read that we are literally exposed to 80,000 different chemicals each week. Think about it. Paint on your walls, glue on your carpet, chemicals in your deodorant and cologne, your hair products, your makeup, your dry cleaning, and even your cookware. Your body is under constant assault. I have talked to fibromyalgia patients that said their fibromyalgia started after an automobile accident. For them, that was the straw that broke the camel's back. I've talked to fibromyalgia patients who broke down after a divorce. For them, that was the straw that broke the camel's back. Some of them had no specific event, but a distinct start date, a day that they seemed to have fallen apart. For others, it was gradual, with no specific start date. As you can see, each fibromyalgia patient has similarities and differences. What you need to understand, however, is that every fibromyalgia patient is suffering under multiple layers of dysfunction. Now, in order to recover, you have simply got to lighten the load. The lighter the load, the greater the opportunity your body has to do what it does best, which is heal itself. The first thing I do with a new fibromyalgia patient is an in-depth consultation and review of medical history. Like the layers of an onion, you have to peel off one layer of burden after another. Now, I want to talk about how we unpeel the layers of dysfunction for a fibromyalgia patient in a clinical setting. I'm going to let you listen to one of my patients tell her story. I'm doing all of this in an effort to help you see your path to successful recovery. As I mentioned, the discovery phase includes a complete and thorough medical health history metabolic assessment form, which help us determine the underlying causes of fibromyalgia. Then we consider which advanced testing makes the most sense and provides the most information. The advanced testing may include stool samples, urinalysis, saliva samples, hair samples, blood work. The advanced testing that we do often reveals things like leaky gut syndrome, autoimmune diseases, yeast overgrowth, pathogenic and opportunistic bacteria, parasites, chronic viruses, adrenal fatigue, food sensitivities, systemic inflammation, as well as environmental toxins and heavy metal toxicity. And these are just the most common. Now, when you consider the concept of multiple layers of dysfunction, every fibromyalgia patient that we have ever treated has 3 or 4 or 5 of these things going on. As we resolve each of these underlying conditions, we see the restoration of health and actually beat fibromyalgia. At this point, I want you to meet a patient of mine by the name of Dorothy. She is a classic case of fibromyalgia. I want you to listen carefully to the conditions that Dorothy had been diagnosed with. I want you to make a note of the aggravating factors that we found through our advanced testing. This was done about 10 years ago in our Birmingham office, and I talked to Dorothy not long ago, and she's still doing very, very well. Her video is short, about 3 minutes, and we'll go on when it's finished.
Ready.
Okay. Dorothy, tell me why you came to see me. What was your diagnosis before you came in?
I had lupus, fibromyalgia, IBS, Raynaud's, and depression.
Mm-hmm. Okay. And had you been to other places before?
I'd been to other doctors,
Okay.
and they just kept giving me pills, which
Weren't helping you
no,
much.
and just making other things worse.
Okay. And then, of course, we practice functional medicine here, but we did some lab testing. Well, we talked to you. We got your
Right.
history.
Mm-hmm.
We did a thorough history. We did a timeline. We looked at things that might affect you. And then we did a metabolic assessment form, which basically was a series of questions that break down into different body organs, for instance, or systems where your symptoms are. And we decided on a course of action, starting with testing, right?
Right.
Had you ever had any of that testing done before?
No.
Okay. So during that testing, we did a stool and a saliva sample. We found yeast, right? We
Right.
found yeast overgrowth. We found bacterial dysbiosis. We found that your enzymes weren't digesting your food, which is what we talked about a minute ago.
Right.
And through the adrenal stress index, we found that you did have some adrenal fatigue and also gluten sensitivity
Yes.
and decreased secretory IgA, which is the mucosal lining of the gastrointestinal tract. So once we found that out, we set a course of action which involved diet and lifestyle changes and some pharmaceutical grade supplements. And this is, how far into the program are we? Close to 3 months?
I was close to 3 months, I think.
Yeah. And then how are you feeling today opposed to the way you were the day you walked in here?
Oh, I'd have to say 85 to 90% better. I'm not nearly as tired. I've got more energy. Aches and pains are going away. The Raynaud's has decreased. Not having so much trouble with my stomach. I'm doing pretty good.
Okay. Now, if someone manages to watch this video that has, because this is not new for you. You didn't just get sick. This has been something you've dealt with for decades.
Decades, yes.
I mean, decades. So within just 3 months, we've been able, with all natural care, to turn your symptoms around to the point that you're saying, well, somewhere 80, 85, 90% better. That's pretty amazing. But if someone is watching this that's frustrated, that's been to many doctors and gotten no relief, would you recommend that they at least look into this type of treatment?
Oh, absolutely, because I have found that other doctors I went to, they never did any testing. It's just, well, I think this is it, here's a pill. And we never got to the root of it. And getting to the root of it, finding out what I shouldn't be eating and not eating it, it's made all the world difference.
Yes, definitely. Well, I want to thank you for taking time to share. I know it's kind of, you're vulnerable in a sense, but you know what it's like to struggle.
Oh, yeah.
You know what it's like to fight and to feel frustrated and discouraged because answers seem to be just hard to find.
It is.
But I thank you for being vulnerable and sharing your testimony with folks. Thank you.
You're welcome.
All right.
Talk about multiple layers of dysfunction. She is a perfect example. Our initial interview revealed that she had been diagnosed with fibromyalgia, Raynaud's disease, lupus, which are both autoimmune conditions, irritable bowel syndrome, and depression. Our metabolic assessment forms and advanced testing revealed that she had a gluten sensitivity, yeast overgrowth, and a parasite, as well as leaky gut syndrome. Once we discovered what the multiple layers of dysfunction were, we unpeeled them with the use of pharmaceutical-grade supplements, dietary and lifestyle changes, followed by a period of detoxification where we healed and sealed her gut lining. Now, let's establish the premise of a syndrome concerning Dorothy. Remember, a syndrome is simply a collection of symptoms that can be caused by a variety of different issues. We talked about multiple layers of dysfunction. You see that very clearly in Dorothy's case. Once you know what the layers of dysfunction are, it's easier to peel them back. This is the main reason you're not getting better. You haven't discovered the true underlying causes. In Dorothy's case, she had 2 previously diagnosed conditions that are actually autoimmune diseases. That means that her immune system was literally attacking different parts of her body. I recognize that she may always have these autoimmune conditions, but they can be managed to the point that she almost doesn't know they exist. The irritable bowel syndrome was actually caused by the gluten sensitivity, yeast overgrowth, and the parasite. Those were the major aggravating factors of her immune system, which in turn made the underlying autoimmune diseases worse. So as we unraveled these issues, her health improved dramatically, and so will yours. I believe, just like Dorothy, you can get your life back and recover from fibromyalgia. Dorothy took part in our Fibromyalgia Heroes coaching and implementation program, and it changed her life forever. Now, let me ask you a question. Have you learned more about fibromyalgia in the last few minutes than you've learned in your multiple visits speaking to your primary care physician? If so, I've got some good news for you. Because you watched this video to the end, I'm going to give you an opportunity to have a fibromyalgia assessment phone call. This call is with me directly, not someone who works for me. I normally charge $385 for our initial consultation. You have a choice to make. Keep doing what you've been doing and get nowhere, or get help from someone who has walked hundreds of women through the process of recovery and get better fast. Go ahead, click the button below to schedule your fibromyalgia assessment phone call, and I am excited to speak with you one-on-one.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Dailey at www.talktodrd.com.